Hello. I just wanted to go over with you the public health infectious disease paper. This is going to be the large paper that you're going to be writing for your class. Basically what I want you to do is utilize all of the materials that we discuss in class related to control of infectious diseases, the individual infectious diseases, and basically develop your own proposal for how you would actually prevent or treat one of these diseases. You can pick whichever one you would like. It could be the same exact one that you've been using for your journal club, your individual research paper, article critique, as well as the individual disease paper. You can expand on that. So I'm not saying that you have to choose a different one. So this actually makes it a lot easier for you and for me that I can compare and contrast on how you actually write this. I don't want you just necessarily copy and pasting, but as you tweak it to make sure that it includes all of the materials necessary for this paper. But very simply, I need you to understand that this is going to be worth 50% of your final grade, so it's going to be huge. Effectively, this is your entire class, so make sure you focus on this a lot. I'm going to have in specific dates that everything is due. However, if you're moving forward faster, I don't mind reading it earlier and giving you grades earlier. But it's going to compose of basically 5 different sections. The first one is going to be introduction and background. In this one, you're going to talk about the disease. What is the infectious disease that you're looking at? What are the biology aspects of it that makes it an infectious disease, and so on. And that's going to basically be 1 to 2 pages long. This is all single-spaced pages and size 11, size 12 font, standard indentation. I'm not going to be very critical of it, but just make sure you get enough information that you can explain the actual individual disease that you're looking at. The next section is going to be the magnitude of the problem. Who's affected? Who's infected? How many people are infected? Where are they infected? Is it a specific subgroup of population? Is it, for instance, women and children that are infected? Is it immunocompromised people, and so on? And then also the numbers, how many DALYs are infected, and does it cause a certain number of deaths or injury, and so on. And that's going to be 2 to 3 pages long, and that will represent also 10% of your final grade. The next section is understanding the key determinants of the disease and the individual stakeholders. So this section is going to be 2 to 3 pages long, and I want you to go more into what are the factors that actually cause this disease to be a problem. Is it related to issues like poverty or access to medication, or is it things like women's issues, women's equity problems, and so on. And then you want to talk about the stakeholders as well. What are the international organizations that are participating in this in these efforts? What are the NGOs, the non-government organizations that work in it in the country that you're going to choose? What are the government agencies, the doctors, everything, anyone that's involved in the process, drug makers, anyone that you can think of. Basically, from beginning to end of the process of this disease, who is involved in it and how are they involved, and that's the stakeholders. And that's going to represent also 10% of your final grade. The next section is going to be the major part of your paper. I want you to develop an intervention or prevention strategy. It doesn't need to be anything brand new. You can build on something other people have done. You can expand the scope, the size, or maybe if you want to expand a program that's currently existing. For instance, if you wanted to say, there was a malaria bed net distribution and you wanted to provide artemisinin therapy as well, you would basically describe that as your program and why you're going to add that specific component to it. And then that's going to comprise 5 to 10 pages of paper, and that's going to also represent 10% of your final grade. The final section is monitoring and evaluation of the strategy. This is 2 to 3 pages long and 10% of your final grade. In this section, what you're going to do is you're going to write how you're actually going to monitor the results. Are you going to do a before and after survey before the intervention and after the intervention? And what are you hoping to gain? 10% reduction, 20% reduction in incidence, and so on. I leave that up to you. I understand that you may not know what exactly you're expected to get, but you can look at other papers and see how much they've done and what their interventions actually produced, and you can use that as a guideline for what you're going to do. I'm not going to grade it specifically on how much you say you're going to do, but rather your thought process and actually coming up with that answer. For this paper, I would like it to be focused on a developing country. It can be a low-income or middle-income country. but I would like it to focus on one country, or if it's a regional aspect, I'll allow a couple of countries, but try to keep it localized to one country. I'm not going to choose any countries. If you're interested in any particular country and have a question, please feel free to ask. When you're complete with this, you're also going to then produce another narrated PowerPoint presentation, again, about 10 to 15 minutes, and you're basically going to pitch to me. I want this to be as if you're making a proposal to me on your actual infectious disease strategy that you would like to present. And for that, I want you to, again, do PowerPoint, 10 to 15 slides, 10 to 15 minutes, and post it basically on either Blackboard, or if you're having trouble with Blackboard, you're free to email it to me and I can post it. And that's really it. Let me think if there's anything else. That should be it. But for the grading, so for grading, we are going to, hold on just a second. There we go. We're going to have individual due dates for each thing. So for instance, in the week of February 16th to the 22nd, your introduction is going to be due. That's pretty much in a couple weeks from now. So you want to start working on that. You can again use some of the information you used from your individual disease paper to start with that. Then the following week, your magnitude of the problem will be due, and then the following week after that, the key determinants. You will have a couple of weeks then to work on this intervention and strategies, because that's the biggest part. And then the following week, we'll have the monitoring and evaluation strategy. The second to last week of class, your proposal will be due and submitted again either in Blackboard or email to me if you're having trouble with that. I am going to review each of these. I'm going to be reviewing each of these prior to the final date that it's due, but I will not be grading it until the very end. I will send you some feedback if I see anything that's glaring that you can correct each individual section before they're due. And then on the due date, I'll finally grade them and then hopefully have it to you before your final exam is done, so you know exactly how much you need to do for your final exam. That's about it for this, and if you have any questions, please feel free to email me or post it online, and I'll be happy to answer. Thank you very much.